Dr. Nate here at Thrive Dental Orthodontics, and you're probably here because you are Googling or YouTubing what is an overjet. So I'm going to explain what that is, and I'm going to give you the 4 ways to correct your overjet. Okay, step number 1, what is an overjet? Overjet is when your top teeth are sticking out compared to your bottom teeth horizontally. So they're sticking out a lot like this. That is different than an overbite, which is very common. People come to me, they say, hey, I have an overbite, and I look at them, I'm like, that's not an overbite, that's an overjet. Most of the time I'll correct the patients, but sometimes I won't because it's just too much of an explanation. But here in this video, I can go in detail and tell you what the difference is. So remember, overjet is when the top teeth are sticking out compared to the bottom teeth. They can be up, down, whatever, it doesn't matter. If they're sticking out horizontally, that's overjet. If they're overlapping vertically, like an overlap, we call that a deep bite or big overbite. So that is the difference. Overjet is sticking out, overbite is going deep, and the top teeth are overlapping the bottom teeth a ton. Okay, now you're more educated than like 99% of the people out there, so let's talk to you about the 4 ways to correct an overjet. Let's start with the very easiest one. Step number 1 is using some rubber bands. As I've explained in other videos, rubber bands are the things that are going to help correct your bite, and those are the easiest things to do. As long as you wear them, you're going to get a great result. So hopefully you're wearing them if your orthodontist tells you to wear them. So if you're trying to correct an overjet, we use something called the Class 2 rubber band, and that is probably the most common rubber band that is used in orthodontics, and that just goes from your top canine to your first molar. As long as you're wearing that and your overjet is not too big, you can correct most overjets with just some rubber bands. I'd say like 90% of the people can correct their overjet with just a few rubber bands. Step number 2, you're saying, hey Dr. Nate, my top teeth are sticking out, my lower teeth actually look fine. It's just my top teeth stick out like crazy. I hate how that looks, I don't want to get surgery. Just how do I correct this? And the way we correct that is taking out 2 top teeth. Now I don't do this very often because I do not love taking out top teeth. I don't like taking out perfectly good teeth in general, but that is a way that we correct it when you have a big overjet, and it's mainly due because the top teeth are sticking out like crazy. So how does this work? We take out those 2 top teeth and we basically essentially bring back those top teeth to match up with the bottom. So that is a very easily guaranteed way to bring those top teeth back to match with the bottom teeth. Remember, that's bringing the top teeth back, that isn't bringing the lower teeth forward. Whereas in most cases, most people's issue is because their lower jaw is behind the top jaw. That's why I'm saying taking out these 2 top teeth, we do maybe 10% of the time, maybe, but that is one option to correct an overjet. Option number 3, if the rubber bands just won't cut it, or maybe you're not wearing them, you're gonna get something different called either a Forces appliance or Herbst appliance. You may have seen these on some TikTok videos or YouTube videos, and that is when you have this little piece of metal inside your mouth. It's not on the outside, it's on the inside. We do not do headgear. Almost nobody does headgear anymore, so don't do headgear. But this is on the inside of your mouth, and it's these little kind of pistons and rods that hook from the top jaw to the bottom jaw, and they push your lower jaw forward to meet up with each other. And this is really good if that overjet is too excessive and the rubber band just won't cut it. We use this maybe on like 15% of the patients or so. I don't love using them because they're kind of bulky, and I just rather the patients use rubber bands. But if the rubber bands won't cut it, you're gonna need something called a Forces or Herbst appliance just to help with that overjet. Okay, you know there's a 4th way. What is the 4th way? This is the most drastic way to correct overjets. We rarely use this, maybe in 1% of the patients, and that is when the overjet is crazy big, and it's not so much a tooth issue, it's more so a jaw issue. So if your lower jaw is just way too far back, your top jaw is way too far forward, and you can't maneuver the teeth in such a way to get a good bite, you're gonna need something called jaw surgery. And I do other videos when I go into detail about different types of jaw surgery, but essentially most of the time, and this is gonna vary a ton per person, you cut the lower jaw and bring it forward. And that is not me doing it. I will never cut a jaw. That is the oral surgeon who does it. So this is how it works. You basically get braces. Sometimes you can do it with Invisalign. You straighten your teeth, get them nice and pretty. The bite is gonna be super off, but the teeth are nice and straight, nice and pretty. We send you to the oral surgeon, and then they're gonna perform that jaw surgery on you. Like I said, most of the time it's a lower jaw that they're gonna advance, but sometimes they do the top jaw too, when they take the lower or the top jaw, bring it back a little and bring the lower jaw forward to give you that proper bite. Like I said, jaw surgery is really rare. Maybe like 1 or 2% of the patients will actually go through with it because it's so invasive. Honestly, it's super, super expensive, but the results can be absolutely outstanding, especially if the lower jaw is way too far back. There you have it, guys. Now you know what an overjet is. You know the 4 top ways to correct it. Remember, we have rubber bands, we have potentially taking out teeth, we have appliance like forces or Herbst, and lastly, the thing that we probably do the least is jaw surgery. Once again, guys, it's Dr. Nate here at Thrive Dental and Orthodontics, and thank you for watching this video. If you had any value in this, please like or subscribe, and I put out videos every single week to make you the best, most informed patient ever. So if you have braces on right now, you're probably wondering, how the heck can I get on my braces as fast as possible? Well, you're in luck. I have a next video over here that's gonna go through your best ways to get out of braces as fast as possible.